This is our discussion on Chapter 8 on variable pay, executive compensation, and benefits. At the beginning of the book, there is a figure which I've included in the PowerPoint. If you wouldn't mind, open up Chapter 8's PowerPoint and follow. It is a diagram that illustrates the different incentives that may occur, that may exist. And I have a project for you with regard to this figure, which allows you to rank what you think you would like as an incentive from your employer, from best to least, from the ones you want to the ones you don't want. And we're going to discuss that from at our Canvas show with our peers. But what this project will do is allow you to also define these terms. So obviously, if you're not familiar with what stock options are, which is one of the terms listed on this figure, figure 8-1, page 164, the idea is that you would then have to look that up and then make your determination of your ranking for that item. The book doesn't talk about all of them, but things like service awards and trips as an incentive should be rather self-explanatory. So the discussion that we want to have here is not so much the individual definition of what incentives are, when you can offer them. That's really for that project. So, for instance, on page 167. The author discusses gain sharing, and gain sharing is one of the terms as one of the incentives that you have to rank in my project for you. So again, I'm not going to use this lecture to just redefine that. You can find these in the textbook. The book does a great job bringing them to you. I do want to move on as well and kind of skip over even managing benefits and things like that, and move into the types of benefits that the law requires. And so this is page 173, and there's a figure 8-3 in your book that I've also brought into the PowerPoint. And you'll see COBRA and HIPAA provisions as healthcare benefits that are mandated. The Affordable Health Care Act, ACA, some people refer to that as Obamacare, medical plans, and Medicare. Medicare is paid through the employee and the employer payroll. But the Affordability Act is the big issue here, because it is the first time that employers with 50 or more employees have to offer medical and health benefits, which is what I think the author means in the third bulleted item for medical plans. So the Affordability Act is itself complicated, but it is a mandate for employers to offer the opportunity for employees to buy into a healthcare opportunity. So basically, the employers are required to maintain a certain level of coverage. If they don't, there's a penalty or a tax, an excise tax actually, that the employer then must pay. So there's an incentive, because it's a huge tax, about 40%. There's an incentive for employers who fall under this legislation to then provide employees special healthcare opportunity, like healthcare packages, healthcare benefits. So it also eliminated lifetime limits, which I always found to be cruel in some ways, especially if you know the prices of hospitalization, medical assistance, doctors' fees. A lifetime limit could be easily reached depending upon your physical and mental situation. So there's a lot of good things about the Affordable Health Care Act, and I don't really get into it other than just simply saying that the good side is that now most businesses are required. Most businesses who have 50 or more employees all businesses who have 50 or more employees are required to follow this, and it provides for greater coverage It allows for more people to participate. And if you've ever learned anything about insurance, from buying car insurance to life insurance, the more people that participate, the cheaper the rates, the better the coverage. If you're not sick, I'm not sick, and 10,000 of us aren't sick, but one person is, then we spread that cost over the 10,000. And frankly, that's how car insurance works, life insurance. It all, I think, works out very nicely when everybody is covered. And then individuals aren't suffering financial crisis, having to declare individual bankruptcy just because of a doctor's trip. To me, that's not a political issue. That's just simply an economics issue, a fiscal measure, completely. It's how we operate insurance for cars. It's how we operate every other level of insurance. And we're going to talk about even workers' compensation insurance in a minute. So if you have any questions about that, I'll be glad to work with you. I want to mention, too, there's another area that's a hot spot, which is, as we move through, again, I'm not trying to lecture on terms that are easily found in the book, but one of the other required benefits, the law requires the Family Medical Leave Act, that employers participate in the FMLA. This actually is more of the HR nightmare than you would imagine, because it's in HR where you're going to be keeping record of the individual's eligibility. They have to be working there for a period of a year plus a certain number of hours, and how that's calculated, because if they went from part-time to full-time, can be very complicated, but there's ways in the FMLA that you can do this. And then once you know that the person's eligible, then keeping track of the individual's doctor reports, which allow a trigger the leave, because most of the reasons for the employee's leave have to be under a permission, and typically that's through the doctor, the care provider, except for obviously military members, and there's a few exceptions, but most of this most of the employee leave excuses has to be documented by a primary care provider. So it's the HR office that keeps up with those two items, and then another item is then the actual tracking of days, because when an individual is permitted to leave, again, it's unpaid. The book mentions that that they can't be using other leave. They can't be using vacation or whatever. So they have to take vacation first, and then once the vacation or whatever is gone, then the trigger, then the FMLA is triggered. And so HR has to keep up with where that vacation ends. They've used up their days, and when the FMLA period begins. It is also a period that's intermittent, so an individual could improve his or her health. The doctor provides a statement that the worker can go back to work, and in that regard, then the period of 12 weeks unpaid leave stops. Maybe there's 5 weeks out of the 12 that the employee has used up, and so still that employee would have another 7 weeks during that particular year to use that FMLA option. So again, you have to keep track of this. There's been a number of problems with employees, and you can find them in all of the cases where they've gone back to work without the doctor's permission. They've tried to take vacation at the same time as the Unpaid Family Medical Leave Act allows. It's really a complex matter of just sorting things out and making sure, as an HR perspective goes, that the employee is getting what's due, what's fair under the law. And these are part of hearings. If there is a problem, the Department of Labor is where the individual employee would file a grievance, and then the firm that's the employer firm would then be spending time dealing with that administrative matter, typically resulting in some form of hearing to gather evidence and to make a determination. So that's a waste of time if indeed the employer is correct with the calculations. But I know that attorneys pick up these cases and will represent employees who claim that they were not treated fairly under the FMLA. So again, this is not something that higher management deals with. This is typically just in the HR area, but it can be very complex and nightmarish to keep track of all the different dates, the time frames, the records from the treating physician, and the eligibility issues. And then there's the reasons for the leave. In other words, if it's the birth of a child or birth of a child they've adopted, if it's a spouse that has a serious health issue, all of these again have to be tracked, and there's no one but HR that does these.